Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre. The Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke. Country Program Specialist with the Pan American Health Organization, Annick Wilson. National Epidemiologist, Dr. Shalauddin Ahmed. Coordinator of the National HIV/AIDS Response Program and Health Psychologist, Lester Guye. Welfare Consultant with the Ministry of Youth Development and Empowerment, Youth at Risk, Gender Affairs, Senior Security, and Dominicans with Disabilities, Martin Anthony. Executive Director of the Dominica Association of Persons with Disabilities, Nathalie Murphy. And Coordinator for the Border Reopening Program, Dr. Laura Esprit. Ladies and gentlemen, good evening. This evening's press briefing is twofold. We will first recognize the contributions of the Pan American Health Organization in Dominica's fight against COVID-19. And secondly, we will analyze the impact of COVID-19 on the most vulnerable among us, including children, the elderly, of course, those with underlying conditions, and people with disabilities. But before that, we'll get our statistical analysis from Dr. Shalauddin Ahmed.
Thank you. Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, Permanent Secretary of Ministry of Health, Ms. Annick Wilson, Country Program Specialist, Pan American Health Organization, Mr. Martin Anthony, the Welfare Consultant, Ministry of Youth Development and Empowerment, Youth at Risk, Gender Affairs, Senior Security, and Dominicans with Disabilities. Ms. Nathalie Murphy, Executive Director, Dominica Association of Persons with Disabilities. Mr. Lester Guye, Coordinator, National HIV/AIDS Response Program, and Dr. Laura Esprit, Coordinator for Reopening of the Border. And our very best, Ms. Sheena Harry. Good evening to everyone. We have now 2 more cases since the last press briefing, and this brings the total number of confirmed cases of COVID-19 in Dominica is 35. The new cases are a 60-year-old male from Canfield and 53-year-old female from Portsmouth area. They were detected through routine screening on October 15th and October 17th, respectively. These are imported cases. Both had valid negative PCR results before entry into Dominica. They are asymptomatic. One of them has underlying medical condition, namely hypertension. 15 contacts were identified and investigated from the case number 34, and none from the case number 35. All contacts were negative through PCR testing. All contacts are currently in isolation. So in summary, as of today, the total number of confirmed cases is 35. Total active cases are now 6. Total contacts investigated since the opening of the border are 157. All are negative except 3 of them. That's included in the number of positive cases. So presently, there is no evidence of community transmission. However, community transmission is inevitable if we fail to adhere to wearing a mask in public settings like crowded areas, mass transportation, and gathering places. 2, proper hand washing or sanitizing with alcohol-based sanitizer after touching any surface, doorknobs, counters, and door handles in places outside of your own house. Keeping the physical distance from someone who is not a family member to you. So with this, I thank you for your attention, and good evening.
Our thanks to Dr. Ahmed for his continued efforts in our fight against COVID-19. Again, 2 new cases recorded here in Dominica. The contributions of the Pan American Health Organization cannot be understated. And from the onset of this COVID-19 pandemic, PAHO has come on board to ensure that Dominica has the requisite tools to fight COVID-19. And to speak more on that, Ms. Annick Wilson is the country program specialist for the Pan American Health Organization.
Thank you, Madam Chair. Minister of Health, Wellness and New Health Investment, the Honorable Dr. Irvin McIntyre, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, National Epidemiologist, Dr. Ahmed, Coordinator, the National HIV/AIDS Response Program, Acting and Psychologist, Mr. Lester Guye, the Welfare Consultant, Ministry of Youth, Development and Empowerment, Youth at Risk, Gender Affairs, Senior Security, and Dominicans with Disabilities, Mr. Martin Anthony, Executive Director, the Dominica Association of Persons with Disabilities, Ms. Nathalie Murphy. Good evening. It's an honor on behalf of Dr. Yitadis Gibre, the PAHO WHO representative for Barbados and the Eastern Caribbean countries, the United Kingdom, overseas territories, and the French dependents, to participate and bring special greetings as we collectively discuss COVID-19 pandemic response. We must be reminded that the COVID-19 pandemic is far from over. As stated by the World Health Organization, the incidence of new COVID-19 cases has continued to accelerate, while the incidence of new deaths has remained relatively stable. As of October 18th, over 40 million cases and 1.1 million deaths have been reported globally, with over 2.4 million new cases and 36,000 new deaths reported over the past week. The countries reporting the highest number of cases in the past week remain the same as the previous weeks. That's India, the United States of America, France, Brazil, and the United Kingdom. It is worthy to note, though, that Dominica is among the few countries considered to be doing very well and presently rated as a moderate risk country by the CDC. This, however, does not allow for complacency. Vigilance and continued public health measures must be emphasized and practiced always. This includes social distancing, wearing of masks, and hand washing or sanitization of hands when washing is not possible. One may ask, what's the main objective of health services in its response to COVID-19? This would be primarily to save lives. However, in this time of uncertainty, it is to prevent as much as possible the disruption to health services to the public. Our director, Dr. Carissa Etienne, said, prolonged response to this pandemic must include continued provision of other essential life-saving services. Hence, PAHO is calling on countries to adapt to this new situation and to re-engineer how essential care is delivered and to invest in the first level of care, using things like telemedicine, home visits, and community outreach programs to support vulnerable populations. At the same time, they must also mitigate the efforts of COVID-19. This is not a choice. Rather, governments must strike that careful balance for the sake of public health. Should cases increase significantly with limitations to accessing health services, the aforementioned must be considered to include community outreach programs to the most vulnerable and at-risk populations. A country's capacity to respond to the pandemic will depend on multiple factors that affect the spreading of the virus in the population. We must note that all actions that reduce the incidence of cases in each time period that helped to prevent the collapse of the health services. We must learn from what has happened in many countries that had community spread, and by so doing, put measures in place to prevent disruption of services, especially to clients with chronic diseases, children and adults who may require immunization, antenatal services, among other services. In the Washington, D.C. August 4th publication, it was noted that health services are being disrupted in countries of the Americas as health workers are redirected to care for COVID-19 patients. As such, people hesitate to seek routine care due to fears of infection, and global supply chains of medicines and equipment are strained and even difficult to obtain. They are without much needed doctors and nurses available to offer essential services at the first level of care, including pregnancy-related care and management of chronic conditions like diabetes or infectious diseases, such as dengue, HIV, and TB. These services can be severely impacted. Many countries, in fact, more than a quarter of countries have suspended routine vaccination campaigns, and months of disruption will increase the risk of outbreaks. As a country, you must continue to ensure that vaccination coverage is over 95% and strategies put in place to deal with disruptions through community outreach. Now, Dominica continued its vaccination program even throughout the lockdown period, and this has certainly contributed to the prevention of infectious diseases that are covered under the expanded program of immunization. Countries, with Dominica being an exception, can respond to COVID-19 by continuing the provision of access to testing and contact tracing, while also offering other essential services like immunization and mental health support. An integrated approach saves patients time and resources while improving the quality of care they receive from the health service. We cannot forget that primary health care investments also improve efficiency and reduce healthcare costs and enable hospitals and communities to expand capacity in other areas of care. As we continue this path towards universal health, countries must ensure that their health systems are resilient and that they have the resources, the supplies, and health workers they need to fight the pandemic, while also keeping people healthy and protecting others and each one from diseases. Now, PAHO continues to work with countries to respond to the pandemic. Starting from the very beginning of the pandemic in the region, PAHO contacted the Ministry of Health in Dominica for an assessment of their needs and shared the required measures to minimize the spread of the virus. In this regard, PAHO deployed a team of experts to Dominica to support the development and implementation of the preparedness and response plans. This included many virtual trainings of staff on infection prevention and control, laboratory testing, mental health training, clinical management of cases and procurement of laboratory equipment and personal protective equipment. And most recently, the preparation for the introduction of the COVID-19 vaccine when it becomes available. The tourism sector also benefited from infection prevention and control training. And the machine for the PCR testing was also procured with funding from the Pan American Health Organization. An 8-seater vehicle was also procured to provide support for community surveillance. It was just on Friday, the 16th of October, a formal handing over of PPEs were issued to the Ministry of Health, and they include face shields, 31,000 examination gloves, 16,600 goggles, like 6,200, 186,000 medical masks, 62,000 N95 masks, 100 oral thermometers, and 10 forehead thermometers, all of which accounted to $239,940 US, of which 45,169 US was financed with funding mobilized through the Government of Canada. Now, this was not the first handing over of PPE. It was the third such gesture since the start of the COVID-19 pandemic. Now, PAHO continues to provide support in the prevention and control of infections among healthcare workers as well. 3 thermal imaging machines were also procured and handed over. Same would be hoist at the Douglas Charles Airport to monitor the temperature of the traveling public at a cost of $46,350.42. Many guidelines were also shared to support and guide the country in its management and response to the COVID-19 pandemic. Many other activities would be supported through PAHO, WHO Technical Cooperation work in country with funds from WHO, DFID, and Canada. We are also entrusted with the implementation of a $1 million World Bank Fund project in the response to COVID-19. These in-country activities are guided by the present Strategic Preparedness and Response Plan, which covers 9 strategic areas, namely country coordination and planning and monitoring to the tune of $87,000. It deals with buying equipment for the health EOC. Risk communication, $14,000, deals with a lot of media campaigns as it relates to gender-based violence and messages for different at-risk groups, including smokers, persons with disabilities, and migrant populations, as well as the procurement of IT equipment for the COVID-19 response. Under the 3rd pillar, as it relates to case investigation, $635,000 has been allocated there, and that has to do with scaling up of surveillance and contact tracing, human resource strengthening for training for community health aides. So right now we are training a cohort of community health aides through funding from PAHO, implementation of a COVID-19 module as it relates to the perinatal information system. On the points of entry, $21,000 was allocated there to develop and review and update guidelines for surveillance for points of entry, also to develop and strengthen the surveillance and triaging at isolation sites. On the laboratory, $80,000 was allocated there, and that's for the procurement of PCR-related reagents and equipment and electronic support to the lab. On the infection control, $225,381, and that has to do with a lot of medical supplies like respirators and other medical equipment, including we're going to be building some wash stations at clinics and also some sanitization. We're going to be procuring sanitization equipment. There's also going to be support for training in terms of protection of frontline workers. In terms of case management, $93,000 was allocated there, and that's also again for medical equipment, including pulse oximeters, among many other types of equipment. Operational support and logistics continues through PAHO, and last but not least, maintaining essential health services, $25,000 was allocated there, and that's mainly for training of clients on self-management, to procure Dopplers, and to improve foot care management at the clinic level. And also, refrigerators would be purchased, it's being purchased right now, to help in the cold chain management as it relates to immunization. In conclusion, PAHO stands committed to the continued provision of technical cooperation support as we work with Dominica to provide the much-needed support in the response to the COVID-19 pandemic. I thank you.
And our thanks to the Country Program Specialist of the Pan American Health Organization, Anik Wilson. And on behalf of the Ministry of Health, Wellness and New Health Investment, let me extend again our gratitude to PAHO for their contributions thus far. There are tangible resources that they have provided, but we cannot overlook the strengthening of our human resource capacity as well. With us this evening, we have welfare consultant with the Ministry of Youth Development and Empowerment, Youth at Risk, Gender Affairs, Seniors Security, and Dominicans with Disabilities, Martin Anthony.
Minister of Health, Wellness and New Health Investment, Dr. Irvin McIntyre. Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade Wyke. Country Program Specialist, Pan American Health Organization, Annick Wilson. National Epidemiologist, Dr. Shalauddin Ahmed. Coordinator, National HIV/AIDS Response Program, and psychologist Lester Guye, and Mrs. Nathalie Murphy, Director of DADP, also Dr. Laura Esprit. The World Health Organization, WHO, has stated that COVID-19 pandemic is disproportionately impacting the world's most vulnerable. This is supported by the Inter-American Development Bank, IDB, which states that COVID-19 is not an equal opportunity virus. Certain demographic groups are more vulnerable to adverse impacts. The IDB states that the approach to vulnerability often is mainly related to biological and individual attributes and focuses on risk factors and mortality among various groups like the elderly, women, children, and indigenous populations. However, many researchers and publications cite the need to adjust and broaden the perspective of population in vulnerable conditions to make it relevant for the response to the pandemic. The CARICOM heads of government at the early stages of the pandemic recognized the risk of the novel coronavirus COVID-19 to the region, and the heads indicated that the outbreak could reverse economic gains at the CARICOM level. Much focus has been particularly on three groups because of very high vulnerabilities. Those groups are children, older persons, persons with disabilities, and women. And so this presentation will specifically reference those groups. The United Nations Children Fund, UNICEF, is warning that the impact of COVID-19 on children extends far beyond the spheres of their physical health. A new report released by the UN agency revealed that the pandemic is having profound effects on children's mental health, social development, safety, privacy, economic security, and beyond. One UNICEF representative stated, and I quote, "There are unseen issues. There are issues of mental health and issues of social health. When we see day after day images on TV of family members getting sick, there is a mental toll here, a toll of anxiety, sadness, and lack of hope," unquote. The Inter-American Development Bank supports UNICEF's claim, as it states that certain disruptions to both services and homes is unprecedented, and unless swift action is taken, consequences for child development could be devastating. Children, especially children living in poverty, are among those most vulnerable to the financial consequences of a crisis. They are the first to be neglected and, almost always, those in which we invest the least. This pandemic has made children even more invincible, particularly because, from a medical point of view, they are less affected by the virus. Individuals with various challenges, including those visually impaired, are often dependent on other individuals for sustained livelihoods. This means that they are vulnerable and the coming of the pandemic will no doubt further exacerbate their circumstances. People with disabilities are not only vulnerable in terms of mortality and morbidity, but very important in the area of poverty as a consequence of COVID-19. Other vulnerabilities include psychosocial disabilities, including fear, anxiety, and depression. Older adults are particularly vulnerable, with the United Nations highlighting the fact that older persons have become one of its more visible victims. We often speak of their vulnerability in terms of underlying medical conditions, which dispose them to a higher risk of serious illness and death. But age discrimination can have a direct and often disastrous impact on the ability of older persons to access services and goods as put forward by the United Nations. Their direct needs can be overlooked and result in increased social isolation and food insecurity. One of the recommendations is to strengthen social support. In relation to social support, HelpAge International suggests direct access to social support and essential supplies for older people in quarantine or self-isolating, and a proportionate and non-discriminatory approach to restrictions on freedom of movement. It adds that communities must work together to ensure everyone's well-being during the response. UNFPA hosted a recent event which brought together experts from various fields to discuss the global impact of COVID-19 on women and girls. The point was made that at that forum that women and girls have been disproportionately affected during the pandemic by increased rates of gender-based violence, lack of access to sexual and reproductive health care, and economic and food insecurity. Having highlighted how the pandemic has caused displacements on children, the elderly, persons with disabilities, and women, thus resulting in vulnerabilities of various kinds, one may ask, what social safety net programs are in place here in Dominica to address those vulnerabilities? The recovery strategy from the social services sector under the Ministry of Youth Development and Empowerment, Youth at Risk, Gender Affairs, Senior Security, and Dominicans with Disability is centered on 3 pillars. 1, scaling up of psychosocial support for the most vulnerable, including survivors of gender-based violence and child abuse. 2, enhancing current social protection programs to a wider clientele, that is, those who are poor and vulnerable, through established mechanisms. 3, expanding support to government-assisted care facilities to facilitate enhanced service delivery to children, juveniles, and senior citizens. The strategy is a direct response to the recovery needs triggered by the impact of the event on employment, incomes, livelihoods, and quality of life. Efforts are ongoing in regards to the 3 pillar areas. One of the recommendations from the Inter-American Development Bank on the matter of social protection is right in line with one of government's social safety net programs during the pandemic. The IDB suggests financial support to all families who are at risk of social exclusion or vulnerability as a priority, because the lack of an income source for caregivers or adult family members can, among other things, directly affect child development. The Ministry of Youth Development and Empowerment, Youth at Risk, Gender Affairs, Senior Security, and Dominicans with Disability, with assistance from the World Food Programme, has initiated the COVID-19 Social Cash Transfer Program to assist vulnerable households. It is reported that over 5,000 applications have been received by the ministry and have been processed for payment of cash transfers to selected applicants, recipients of public assistance, by virtue of the fact that they are deemed indigent, will be on the list of selectees. Also on the matter of cash transfer, which benefits children, older persons, persons with disability, and women, as a whole is in line with government's monthly cash transfer program referred to as public assistance. That program targets indigent individuals, and it can be said that such a policy by government to set such a program in place with financial increases over the years fits squarely with the advent of COVID-19 in bringing relief to individuals. Annually, over $6 million are set aside under budgetary allocation. The foster care program, administered by the Welfare Division and which caters for disadvantaged children who reside with substitute families, is a beneficiary of the budgetary allocation. In addition, various institutions, including those caring for the elderly like the infirmary, received a combined total of over $1 million as grants and contribution. One can say that if those social safety net programs were not institutionalized, the target groups would become very vulnerable during this pandemic. Noteworthy is the action taken by the Ministry of Youth Development at the beginning of the pandemic to meet with administrators of various institutions caring for older persons to discuss a protocol and procedures developed by the ministry for the protection of individuals in institutions from the possibility of becoming victims of the virus. Mention can also be made of the Yes We Care program and the services of the NEP workers in caring for homebound elderly. Institutional care of children in receiving adequate care and protection is worth mention, since, as UNICEF pinpointed, the pandemic has brought about profound effects on children's mental health, safety, and security. The establishment of chances, which attends to children in difficult circumstances, and also the work of Operation Youthquake must be commended. In relation to women, the Ministry's responsibility for gender affairs in partnership with UNDP and working with the Bureau of Gender Affairs has initiated a project with certain activity towards gender equality and to integrate gender into government's COVID-19 response. Among the activities is entrepreneurship training and gender-based violence prevention and response. Importantly also is the social programs under the Social Security and Aid Bank. In conclusion, I wish to state the words of the Secretary General of the United Nations. He says, and I quote, "All of us face a common threat, the coronavirus COVID-19. Today's declaration of a pandemic is a call for action, a call to action for everyone, everywhere. It's also a call for responsibility and solidarity as nations united, as a people united. As we fight this pandemic and this virus, we cannot let fear go viral. Together, we can still change the course of this pandemic, but that means addressing inaction." I thank you.
And our thanks to Mr. Martin Anthony, Welfare Consultant with the Ministry of Youth Development and Empowerment, Youth at Risk, Gender Affairs, Senior Security, and Dominicans with Disability. And like he mentioned, the impact of COVID-19 is far-reaching, and we appreciate the efforts of Mr. Anthony and his ministry to ensure that the development of the psychosocial development of our young people is not hindered by this pandemic. Our next presenter this evening is the Executive Director of the Dominica Association of Persons with Disabilities, Nathalie Murphy.
Thank you, Ms. Harry. Honorable Minister of Health, Wellness and New Health Investments, Dr. Irving McIntyre. national epidemiologist, PAHO country program analyst, Ms. Wilson, Mr. Martin Anthony of the Ministry of Youth Development and Empowerment, Youth at Risk, Gender Affairs, Senior Security, and Dominicans with Disabilities, National AIDS Coordinator, Mr. Lester Guye, Dr. Laura Esprit, ladies and gentlemen. I consider this a distinct honor and great privilege to have been invited to be part of this press briefing as we together battle the effects of the coronavirus. I am extremely pleased to represent the community of persons with disabilities. When I speak of persons with disabilities, I speak here of anyone who has a long-term mental, physical, sensory, or intellectual impairment who, with interaction with social barriers, hinder their full and effective participation in society on an equal basis with others. And this quote is taken from the United Nations Convention on the Rights of Persons with Disabilities. We are speaking here of the effects of the coronavirus on vulnerable groups, and needless to say, persons with disabilities fall in this category. What I'm going to do here is to highlight some of the practical examples where persons with disabilities have been impacted. The vulnerability of persons with disabilities is due to stigma, discrimination, social barriers, denial or limited access to services and programs, exclusion or restrictions of their participation in national development on an equal basis with others. So we have a major problem here when it comes to catering to the needs of persons with disabilities. When we first heard of the virus as an organization, we decided that we had to take immediate measures. And one of the areas that we started working on was to ensure that persons with disabilities receive the information necessary to enable them to deal and to battle with this virus. And we shared with the Ministry of Health, Wellness and New Health Investment our concerns and some recommendations as to what can be done to ensure that persons with disabilities who are in the highest risk are not too badly affected. We were concerned with the way the information was being disseminated to some of our constituents. For example, a person who is deaf or hard of hearing, when you have messages, public announcements in audio going out, these people do not have access to that information. So we suggested that some sign language interpretation be instituted or video presentations where these people will actually see what is really going on and understand so that they too will be able to ensure that they protect themselves. I don't know to what extent we have closed captioning, but that this would have been a very good area to assist these persons to get the message across. We heard of social distancing, we heard of health protocols, we heard of quarantine, we heard of wearing of mask. A person who is blind, I remember once there was a presentation on one of the press briefings, and they were showing how you should put on your mask. I was confused as a blind person because I didn't know what was going on. There was nobody around to show us or to assist us to ensure that the mask are worn properly. We have persons who are blind, who live alone. They do not have access to pipe-borne water, but yet still we were told that we have to engage frequent hand washing, sanitizing. How do these persons acquire these relief supplies if they don't have the means to do so? So these were some of the things that really concerned us as an organization. There was a young man who returned from studies, a blind young man who had to be quarantined. And he experienced great difficulty in the center because the persons were not trained to deal with him, to assist. The orientation was not done as it was supposed to. And I'm not blaming anybody, but these are things that we have to consider going forward, because persons who are blind and visually impaired, we depend on sighted persons to help us. We talk about social distancing. How can I not have someone assist me as I am blind? When you talk about social distancing, physical distancing, we use our white canes. We have to constantly sanitize these canes. These relief supplies, quite exorbitant cost. Most of our members could not afford it. Thankfully, the social protection measures that were put in place assisted most of these individuals, and we are grateful for that. In terms of the persons who are mobility impaired, who depend on wheelchairs and other mobility aids to go around, they too need someone to assist them. You have to be constantly sanitizing these equipment, these aids, these devices. So social distancing for persons with disabilities indeed was a challenge. The information of there was widespread. There was a high amount of information sharing that persons with disabilities got. One of the areas that, that was highlighted was a document developed by Senator Floyd Morris, who is blind and who is the CARICOM rapporteur on disability. And he circulated a document saying things to do to assist someone with a disability who contracts the coronavirus. And this we also shared with the Ministry of Health. So it has been and it continues to be a challenge for persons with disabilities. Thankfully, we do not have any cases of persons who have contracted the disease here, but we do know that in the early stages in the communities, one of our members or some of our members there had to be tested, and their test returned negative. So we are hoping that this continues, but we would really like to ensure that the necessary training, the necessary support by those in authority, by those who have the mandate to ensure that this virus does not spread, that we as persons with disabilities continue to be provided for. As the 2030 Sustainable Development Goals say, let us leave no one behind. And this must be the case for us as persons with disabilities. So I thank you for your attention. And as an organization, the Dominica Association of Persons with Disabilities that I represent, we stand ready to work in union and in partnership with everyone to ensure that the lives of persons with disabilities are not too negatively affected by this coronavirus. Thank you very much.
And our thanks to Mrs. Nathalie Murphy, who is the Executive Director of the Dominica Association of Persons with Disabilities, for being such a staunch advocate for your constituents. Also with us this evening, we have the coordinator for the National HIV/AIDS Response Program and health psychologist Lester Guye.
Honorable Minister of Health, Ministry of Health, Wellness and New Health Investment, Dr. Irvin McIntyre, Permanent Secretary of the Ministry of Health, Wellness and New Health Insurance, Mrs. Leticia Lestrade-White, National Epidemiologist, Dr. Shalauddin Ahmed, Country Program Specialist, Pan American Health Organization, Alec Wilson, Welfare Consultant, Ministry of Youth Development and Empowerment, Mr. Martin Anthony, Executive Director of Dominica Association of Persons with Disability, Nathalie Murphy, Dr. Laura Esprit, and the media. As we look at the clinical considerations and recommendations for HIV management during the COVID-19 in Dominica, we must take note that HIV infection is in itself characterized by various clinical and social scenarios ranging from viral suppression, quality of life, HIV-associated comorbidities, example tuberculosis, or virology failure with or without being virally suppressed. Over the years, cumulatively, Dominica has had just above 517 cases of HIV. Our prevalence, fortunately, is one of the lowest in the Caribbean, which is less than 0.75%. And our incident ranged between 12 and 18 cases per year. During the COVID-19, the overall treatment goals get at our HIV patients is maintaining viral suppression. You may ask, what is viral suppression? Viral suppression is having less than 1,000 copies per deciliter of blood of the HIV virus within your system, and also an increase in the CD4 fighter cells, and that we'd like to have above 500. This is achieved through treatment adherence, ensuring a multi-month supply of antiretroviral therapy or drugs, prophylaxis for opportunistic infections, and these are infections related to AIDS and HIV infection, and recommended vaccinations and infections prevention and control. There is no specific data supporting that persons living with HIV and AIDS are at a greater risk than persons unaffected within the general population. But the International Department of Health and Human Services, together with the Center for Disease Control, CDC, has issued interim guidance for persons living with and affected with the disease. Persons ages 60 and over with comorbidities, for example, hypertension, diabetes, chronic upper pulmonary diseases, are already at a greater risk for more severe diseases like COVID or infections like COVID. Smokers are at a greater risk for complications. Antiretroviral therapy and other non-communicable diseases medication supply should be prioritized, and a minimum of 30 days and a maximum of 90-day supplies are given, which Dominica had already adopted. Influenza and pneumococcal vaccinations should be kept updated, and that has also been offered to persons once it's available here in the country. Clients are constantly reminded to liaise with the healthcare practitioners within the healthcare district or through the clinical care coordinator of the infectious disease through the National HIV and AIDS Response Program. We continue to provide treatment and care support to all our clients, but also their loved ones who we have identified as the support system. This family and loved one support system is to encourage that these patients and clients continue to follow the national protocol as it relates to COVID-19, which have been mentioned before, and this would include social distancing, social etiquette when sneezing and coughing, proper hand washing practices, surgical mask wearing, avoiding unnecessary crowded areas, reporting to the healthcare facility if any flu-like symptoms are exhibited, collecting any medication on behalf of those clients or those family members, and helping in facilitating of appointments with the healthcare system. Together with the healthcare provider or healthcare practitioner, persons living with HIV should weigh the risk and benefits of attending versus not attending HIV-related clinic appointments. Factors to include the extent of local transmission here in Dominica, the health need that will be addressed during the appointment, and the patient's clinical baseline of CD4 and viral load, as previously mentioned, and also their overall health. We have or had established telephone or virtual visits for routine, non-urgent care and adherence counseling, which has been done to replace in-person encounters when the need arises. Some of the responses that we have done during the COVID crisis to assist in the HIV fight included promotion of what we call pre-exposure prophylaxis, HIV self-testing, which is right now on the table within the region to help persons to have the test done rather than having to go into a healthcare facility, increased detection, encouraging self-care, which is extremely important because one of the unfortunate challenges we have here in Dominica is a lot of our clients are from the lower economic status or are economically challenged. Provision of psychological support for persons living with HIV and AIDS and inclusive of their families. Advocating for human rights awareness in our healthcare settings. Advocate for actions that promote health for everyone in spite of their status. Advocacy for social protections for persons known to be HIV positive, which at times has become a challenge because of stigma and discrimination. Enable and strengthen our civil society and community-led response, because at times we cannot always meet all of the persons in different communities. We have what we call our vulnerable communities, and at times it's very difficult for them to access health. People with HIV should also continue to do those in conclusion. To maintain a healthy lifestyle by eating right, getting at least sufficient rest during the nights or when it's necessary. Avoid stressful circumstances as much as possible because stress reduces your immune system. And it, again, because you're already immunocompromised, it makes it a lot more dangerous for you. Staying healthy helps your immune system fight any type of infection. And again, being immunocompromised places you at a greater risk. Keep up with personal hygiene. Exercise regularly within your capacity. If you are an older person, an elderly person, you need to do exercises that's within your capacity that keeps you healthy. Make time for working, but also time for resting properly. Talk to a mental health professional if and when it's necessary. Talk to family and friends about your feelings and expectations, especially with COVID-19. There are questions that you probably need breaking down of a more understanding of, so you can have a discussion with your family or your healthcare provider. We encourage physical distancing, recognizing that we can maintain physical distance while remaining socially connected to your healthcare practitioner and also your family. Find wholesome ways for recreation. Also know that it's okay to set boundaries for yourself because your health is your responsibility. Limit the use of alcohol or illicit substances. And if you're a spiritual person, you get engaged in spiritual practices. So I thank you again for the opportunity to spread the message.
Our thanks to Mr. Lester Guye, coordinator of the National HIV/AIDS Response Program and health psychologist. Ladies and gentlemen, our hope this evening is that following this press briefing, we will all come to recognize that there are members of our society who are vulnerable. There are members of our society who do not have the capabilities or the resources that some of us take for granted, and that we, as our brother's keeper, will actually do what we can to ensure that these people are cared for and these people are safe and protected. During any outbreak or any pandemic, it is always noticed that the most vulnerable among us are the most impacted, and with COVID-19, that's no different. So ladies and gentlemen, don't just think of yourself, but when you go out there, think of those, perhaps, who are members of the DAPD, the younger ones, the wives, the mothers who are home and probably are more susceptible to domestic violence. Ladies and gentlemen, whoever else cannot do what you can do, look out for those people. Thank you to the media for joining this broadcast, making this broadcast possible this evening, the Office of the Prime Minister for hosting us, and to all of you for your patience and your cooperation thus far in our fight against COVID-19. Good evening.